Pterygium. Pterygium is a degenerative change of the conjunctiva. It can be stimulated by wind and sun. Patients can notice the move of the conjunctiva over the cornea like the triangle tissue that moves across the limbus. The symptoms of pterygiums can be irritation, redness, uncomfortable feelings on the eye, and sometimes it can make the vision get blurred. The treatment of the pterygiums. Once the pterygium is moved cover on the cornea, we have to take it out. The treatment of the pterygiums is a combination of removing the pterygiums that cover on the surface and cut the graft on the top and rotate to be the barrier on the bare area. The graft have to be attached to the conjunctiva by two methods, one by suture and two by glue. This is the picture before and after the operations. The picture on the left, that is the pterygiums before the surgery, and the pictures on the right, that is the pterygium excisions and with suture the graft. You can see all the stitches that making the graft attached to the conjunctiva. This is a picture of the pterygium excision with conjunctival graft with the glue. The glue will help to attach the graft to the base of the sclera. You can see on the top of the left, that is the picture of pterygiums before the surgery. The top of the right, that is after the operations about 1 week. The lower of the left, that is after the operations about 2 weeks. And the lower to the right, that is after the operations 1 month. The complications of the pterygium excisions can be infections. Infection risk is very low. Before the operation, we recommend patients not to have any infections around the eye, no redness, no discharge, no skin infections. After the procedure, we recommend not let any water get into the eyes for 2 weeks, no swimming, no sauna, and no sports for 2 weeks. Bleeding is a common complication. The bleeding not make any effect to the visions, and the bleeding can be gone naturally within 2 weeks. Recurrence of the problems can be happen about 10 to 15%. It depends on many factors like the pterygium type, the type of the surgery, and how to take care after the surgery. We recommend patients to avoid the sunlight about 1 month after surgery. The dislocations of the graft is rare complications. We recommend patients not rub on the eye for 2 weeks. Put on the protecting glasses all the daytime and change to be the eye shield in the nighttime.